You are most welcome in this session. So today I'll be discussing the interpretation of a prescription. As health workers, shall basically be interacting with the prescription that patients or the public or the the caretaker will be bringing to us, dispense the medication for the patient. So the objectives of the session will basically be to define what is a prescription, types of prescription, forms, parts, and part 2 of the video will have the interpretation of the abbreviation or the prescription itself. So what is a prescription? A prescription is just an order or instruction. This is written by an order. This just the prescription is an order or instruction written by a medical practitioner that authorizes a patient to be issued with or dispensed to the medication for the purpose of treating a particular disease. However, as we saw earlier, that the medication may not only be for treating, maybe for prevention, for managing of symptoms, and any other ailment that the patient could be suffering from. It is through this order that the pharmacy professional provides the medications to the patients, because in a pharmacy we have OTC's medication, those are which don't require a prescription, and the POM or the prescription only medications. I think here should have been POM, the prescription only medication, the prescription only medications to patients. However, if they dispensing OTCs later on in my discussions, I will discuss the difference between OTC and the POM medication. I shall be going, because remember, in our channel the goal is to share pharmacy information. So a prescription is an important order that demonstrates the relationship between a physician, the patients, and the pharmacy professionals, and the nurse who usually administers the medication. Those are for IV, IM, and any other medication. It's just an order. It's just a continued repetition of the same thing. An order for preparation or administration of medication to patients. So there are two types of prescriptions. We have the pre-compounded and compounded. Now, the word compounding means prepared. So it means that I have pre-prepared medication and also those which require to be prepared. Now, in most of the drugs that we shall be dispensing in the pharmacies, they will already be prepared by pharmaceutical industry. So prescriptions that require you to just issue those medications will be called pre-compounded medication. However, in long time ago, and in some cases today, some medications require to be prepared by pharmacy professionals before being issued, meaning that these ones are not there in the shelves. You have to first go in the lab and then prepare them. However, these ones are not common nowadays. These prescriptions of compounded or extemporaneous preparations. However, in some settings like eye care and any other uh, dermatological centers, some medications could be prepared before being issued to patients. Now, who can prescribe? Because they are basically the physicians, the doctors, and specialized physicians, the gynecologists, all those other pediatricians mentioned by a few, and the physician assistants, dentists, these ones we know them, specialized physicians, this is a repetition, specialized pharmacists, or the because as pharmacy professionals we are not allowed to prescribe, write a prescription, but those specialized ones could be allowed to specialize. The veterinarians for the animal patients. Now, the prescriptions which we receive at the dispensary are basically in different forms. They could be handwritten and hand signed on paper, printed on paper and hand signed by the physician, prescriber's handwriting. In the other centers, we have the medication charts. In the art clinic, some charts are used. Just look at the chart and the age group, just dispense the medications to the patient. Others can be given directed face to face. However, these ones are difficult to store by phone, by fax, by email, or these are electronic prescriptions. All these ones could be issued to patient. However, we have realized a trend in some centers, even government facilities, where some prescriptions are now electronic. It's a system. A patient just comes on the counter, and you already know the medications you would issue to the patient. Just system generated. Parts of the prescription. The prescription has basically 6 parts: preliminary information, superscription, inscription, subscription, signal, and the prescribers. Information, so you could have refill information for those ones which are used in each. Now, what does each one contain? Preliminary information is key. It has the date of when the prescription was issued, the demographics of the patients, the name, the age, the gender, the weight, the address. All these ones are important in identification of the patient. And also, as we shall see in my next presentation, as most of these ones are also important in determining the dosage of the drug to be administered to the patient. The diagnosis is important because without knowing the diagnosis, what are you issuing the medication for? This one, name and the facility, name and also the facility. This one is always on the head of the paper. Now, the superscription or the RX, this one means take thou, or you take the following. The inscription, this is almost the main part of the prescription because it contains the name of the product, the dosage form, the strength, the amount to be dispensed, the dosage, the direction of use, all this one, then the frequency of addition within the day and the time. Subscription, to contain the prescriber's directions, the pharmacy profession. So this one is not common to today's prescription. And the signal, these are directions to the patients. Most of these ones are given verbally. So the inscription is key. Prescriber information, the name, the address, even others could give you the phone number. That's important. And refill information, if the prescriptions are for refill or are supposed to be reused, because some prescriptions can be reused over and over, especially for chronic conditions. However, in others, they are supposed to be dispensed that time and not reused. That's why I always tick amount of medication given. So this is a prescription, a simple one. This is the address of the facility, the date, these are the demographics. The age is important, as we shall see, as we shall be proceeding. Diagnosis, because this diagnosis, as a pharmacy professional, you have to link it to the medication. The medications. This is the RX is the superscription or recipe, and the inscription is the main part. Refill, if it's there, then the address over there. So this is a prescription. However, you'll be receiving many different forms and have to dispense them. However, for the completeness of any prescription, at least should have the following information: the name of the facility, the patient's details or the demographics, the disease condition, the inscription, the name of the product, dosage form, strength, the amount to be dispensed, all these, and the physician's detail. At least if a prescription has these, it is considered a complete prescription. So this has been a short presentation, and part 2 of this presentation is about the abbreviations. and the interpretation of these abbreviations. So there are quizzes in our Google Classroom app which have been put there. So always try to attempt them as you'll be given answers directly, and this will help us to try to revise and then see if I've completely understood the information. So thank you so much. Part 2 of this video will be having the abbreviations. Nice time. So you're welcome to part 2 of the video. So here we shall be discussing the abbreviations, the abbreviations which can be found on a prescription. So abbreviations are commonly used on prescription, basically to save time, and then also spaces. The prescription is always small, and all pharmacists and health professionals should be familiar with these abbreviations, because if you know them, you can easily interpret the prescription. Now, most of the abbreviations on prescriptions are gotten from Latin, while others are just the interpretation of the English meanings. So why Latin? As you're going to see in the next slides. Historically, prescriptions were written in Latin and are still even up today. Why? Because Latin is more concise than other languages, and it is universally understood language among medical professionals. So as we are going to see the meaning of these abbreviations, the Latin and the English meaning. However, in today's case, Latin is not commonly used, but we still retain the meanings of the abbreviations. So, for example, all of us know BID. It means twice day. But where does it come from? It comes from Latin, bis in die. Bis means twice. Gut hey, LGTT means drops or drop. H, of course, this one can be abbreviation of English. Hour. HS, at bedtime, but this is the Latin meaning. However, we have this one OD, meaning right eye. It is usually confused with this one OD, which just gotten from English, means once daily. So don't confuse these two, OD, because this one is just the English, just gotten from English. However, not commonly are these ones the OD, OS, OU used today. These ones. However, one day you could find them. Oculus sinister, right eye, oculus utequi, both eyes. Now, TID, this means 3 times a day. However, the Latin meaning is bis in die, because this should have been the abbreviation, Latin, and then the meaning. So TID, TID, ta inde 3 times a day, or TDS, ta inde, so some or 3 times a day. Because for us usually TID and TDS, but if you try to replicate them in English, they don't come out. TIW, twice, 3 times a week. Q or kakwe, every. If you go back with hour, means if, so if I say QH, means every hour. Q1H, every 1 hour. So now this one can also, you could have Q4H, you could have Q8H, every 8 hours. You could have Q12H, and then other, as you're going to see in the preceding meaning. So, but where does this Q comes from? Means from Q and then every hour. So QD, every day. QID is going to be a common one. QID means 4 times a day. QS, this is English, quantity, sufficient. QW, every week. So I'll just stick this one, QID, and then we have seen where they come from, from Latin. However, which are those common abbreviations that we find in pharmacies or in prescription? Sorry, I have them here. A few: ointment, BP, blood pressure, just English blood pressure; cream, oint, concentrated; DIC, discontinued; dilute; divi, dispense; gram. This one is going to be important on the strength of the active ingredient. Microgram, mcg, or sometimes it has that meaning. If I can try to replicate it, let me see if I can look for it here. That one, sorry, it has that meaning there. Micro, that W, the microgram. Forgive me for trying to cover and looking for it, because I wanted my discussions or my slides to be lively. So kilogram means kg. So you're going to see these ones commonly on the weight of the patient. GTT, we saw it earlier, gute, liquid. Max, minimum, maximum and maximum. MDI, methadose inhaler. Now these ones are routes of drug administration. SL, sublingual; SC, subcutaneous; IV, intravenous; injection; INH, inhalation; infusion; IM, intramuscular and intradermal. This is just a repetition. OD, once daily; BID, twice a day; TDA, TDS. We have seen where they are coming from. Latin. QID, 4 times a day. Q, this one, this repetition, and we know them. Nocte, nocturnal; start, immediately; QOD, every other day. These are the hours which we saw earlier. The Q8, which means that if I'm having OD, which is the same thing as saying Q24H, BID, Q12H, TDS, Q8H. So if you find them on a prescription, don't get confused much. OM, every morning; OQAM, QPM, PO by mouth; PRN, as needed. You see this prescription, especially for the inhalers for asthma. PV and then PV per vaginally, PR per rectum. These ones routes of drug administration, as you saw earlier on. Now, times of days, also days are key on the prescription. Times 6 days. So 10/7, always this 7 means a week. So this is 10 days. 5/7, 5 days. Again, this one means a week. So 28 out of 7 means 4 weeks. Never divide. So 1 out of 52, we know that how many weeks in a year? 52 weeks. So 1 week. So if you see 2 out of 52, those are 2 weeks. 2 out of 12, we know how many months are in a year. There are 12 months. So if you see 1 out of 12, that is 1 month. OTC, we saw this one earlier. RX, solution, suspension, syrup. Tab means a tablet, capsule. So if you know, you see tabs or cups. Suspension, this side, sorry. Suppository, pessary, a tincture, topical, troch, a lozenge with food. This is dextrose. Dextrose 5%, D5, D50, dextrose 50%. Normal saline. Sometimes we have dextrose 5% in normal saline, or dextrose 50% in normal saline. D50NS, like D50 or D5NS, all these ones could be there. So don't get confused if you ever see them on a prescription. Just interpret them. RL is Ringer's lactate, which you commonly see as a fluid in pharmacy. WIF, water for injection, nebulizer. AAA, apply on affected area. This is ampoule. Of course, now for the vial, it has no just because it is a short word. Amount, application, all these ones. So these are some of the common abbreviations which you can easily, which you have to get to know. Make sure you replay this video. Try to Google different meanings and any videos which I have not included here in the abbreviations. So as always, we are having more quizzes about this abbreviation in our Google Classroom app. So try to log in as with the email provided. You'll see the quizzes, then try to recall all these abbreviations. So as always, I am Wilson, and then our goal is share pharmacy information.